Welcome back. Thanks for staying with us. The president of the St. Lucia Medical and Dental Association, Dr. Merle Clark, says St. Lucia has definitely stepped up in the COVID-19 fight. However, one notable flaw, she says, remains in the limited testing of people. She called for authorities to consider populous testing, especially in the wake of illegal entry of people from neighboring islands. Jacques Wooding reports.
President of the St. Lucia Medical and Dental Association, Dr. Merle Clark, commended the efforts of health officials. However, she cited several areas where authorities throughout the region have fallen short. An area of grave concern is the targeted approach of testing initiatives. Dr. Clark noted that having already intercepted several cases, it is time for authorities to widen the scope of who should be tested for the virus.
So far, we have no evidence of community spread, but we also have to concede that we are not testing widely. We are not doing as much testing as we should be doing, and that is a complaint around the region. Of course, we liaise with our colleagues around the Caribbean, and nobody believes that anybody is doing enough testing. There is a school of thought that we probably need to be testing everybody, because at this point, who knows who's being exposed to? Because again, just looking at the trajectory of this infection, how quickly one person and exponentially the numbers can grow.
She went on to assure the full support of the Medical and Dental Association to several recent decisions taken by the government, including the move to a state of emergency. However, she underscored that the association will not blindly endorse any abuse of power.
We have to take drastic measures. This is an unprecedented time that we're living, and our response also has to be unprecedented. So we fully support that. Of course, with the caveat that we know, as the adage goes, with absolute power corrupts and absolute power potentially corrupts absolutely. So we all as citizens do have to be vigilant. But we believe that at this point, we really are all in this together. We recognize that we need to fight this invisible enemy, and we all have to do it together, and that policies, whatever is put in place, is going to be for the protection of the St. Lucian public.
Members of SLMDA will be present at various health facilities this week to supplement staff as they deal with an influx of patients resulting from the closure of Victoria Hospital. Dr. Clark promised that SLMDA will continue to provide support when necessary, once members retain access to required protective gear.
We have to ensure when we're sending our soldiers to war, and we all on the front lines, that we send them in protected. And we have insisted on that, that the ministry, we will not work without protective gear. Because if we are not protected, then inevitably we're going to become sick. And if all your physicians and nurses become sick, then who's going to take care of everybody else? So, you're going to war, but you do it strategically, and you do it in a manner where you obviously, it doesn't become a suicide mission, in a sense, for lack of a better word.
She lauded the efforts of Chief Medical Officer Sharon Belmar George, who has been at the forefront of COVID-19 mitigation. Dr. Clark urged members of the public to continue social distancing and sanitation practices as suggested by the Ministry of Health. Port 7 News, I am Jacques Wooding.
Attorney General Stephen Julian says he does not believe that the decision to place the island under a state of emergency was a premature move. He says it is simply a case of better safe than sorry. Rochelle Gonzalez tells us more in this report.
As the folks of yesteryear would commonly preach, precaution is always better than cure, and this is the stance being taken by Attorney General Stephen Julian in relation to the decision taken to place the island under a state of emergency by the government of St. Lucia and the Governor General Sir Neville Snack. The AG sat with Nicole MacDonald, who is the Senior Communication Officer in the Office of the Prime Minister, during a live broadcast of the Command Center, where they discussed a number of topics surrounding the current COVID-19 crisis. During the sitting, Julian was asked whether the government should have waited until the virus had infected more persons before making such a decision. He explained in detail why he believed the call was warranted.
Do we decide to be Italy and what's happening there, this scourge called coronavirus 19, or do we take example from our friends from Taiwan? Do we wait until it is literally knocking at our door, or do we wait before it arrives at our shore to the extent that I saw only this morning in New York, where the healthcare workers are repurposing, and I'm using this fancy word, garbage bags. into protective gear. We know our resources, so I think we have done, and I am convinced that the state has done the responsible thing in trying to curtail any spread beyond the level that it is currently at.
Julian said this is what the nation has been implored to do by the technocrats and healthcare workers from within the region and within St. Lucian Shores. He went on to explain why the process taken to implement the act was necessary.
Having made that declaration and the proclamation from the Governor General, it was duly published in an extraordinary publication of the Gazette, so there's the notice aspect of it. It would now be incumbent, as per the Constitution, the provisions of the Constitution, for there to be an approval of that action. And if nothing was done, it would have lapsed after 7 days. Okay. But we would have had to have made a determination, and we brought it to Parliament as is prescribed by the Constitution, for the House of Assembly, Upper and Lower House, to consider a resolution to approve the order. And once that is done, you need another resolution which would require the order, which would operationalize the state of emergency under the Emergency Powers Act. So if we have those in place, you would then have the framework by which you could have your curfew, you could do all these other things that you need to do to protect the citizenry from the coronavirus, or the spread rather.
The Emergency Powers Act was specifically created to cater to issues surrounding COVID-19. Reporting for Hot 7 News, I'm Rochelle Gonzalez.
Pathologist Dr. Stephen King has been a distinct and trusted voice during the COVID-19 crisis, and he has now weighed in on the debate surrounding whether the declaration of a state of emergency was premature.
There has been debate over whether the declaration of a state of emergency in St. Lucia was premature, as argued by attorney at law and president of the OECS Bar Association, Thaddeus Antoine. Pathologist and former chief medical officer Dr. Stephen King is a proponent of the most stringent measures when it comes to COVID-19, and then a gradual walking back once health officials have a handle on the matter. As such, he believes the government made the right move with declaring a state of emergency.
I support the government 100% on the state of emergency. I think it was needed. There are a number of reasons why it was needed, in my view. One, the Quarantine Act and the Public Health Act and regulations. Yes, they are there, and yes, they give certain powers. But to me, they are not broad enough. So, for instance, if we needed to get more facilities, more hotels to use, if the epidemic really explodes on us, the Public Health Act doesn't really give us those kinds of powers. So I think it's very important that we had a state of emergency. And the other major benefits to the state of emergency. One, it goes a lot further towards ensuring social distancing. It's helping us with our move from VH to OKEU.
He echoed similar sentiments to independent Senator Adrian Ogier, who said that while it is a serious and drastic move, that necessitates such powers be given.
We need certain protections as we do what we have to do. And in emergency situations, you have more protection over certain decisions you have to make. So I think that's also important. I know that there are lawyers out there that will quarrel about that, and I understand that. But the truth is, we are effectively fighting life and death matters here. I do think that the state of emergency should have obviously a limit. I was telling a couple of the senators that I felt that there should be an automatic kill date of after 14 days. It should automatically die, and that if it had to be continued, you'd have to go back to Parliament.
Another criticism made of the government was having a state of emergency while there is only a partial shutdown of businesses. Antoine had in particular highlighted ongoing construction and infrastructural works and other businesses now deemed essential being in operation. Dr. King says the emergency powers under the state of emergency gives Chief Medical Officer Dr. Sharon Belmar George the purview to shut down businesses.
The Chief Medical Officer now has the power to say what that closure should be. So the CMO has the power to close any business, right? So under the emergency powers that have now vested in her, and for that matter, the Prime Minister. So I think we should address which businesses do they want to have open and which ones they want to have closed.
Dr. King says it's unavoidable. All businesses are taking a hit, but he says this is a time where health concerns take precedence over everything.
The director of the St. Lucia Red Cross says the organization has been in a state of readiness for similar situations for over a decade, and so they are ready and willing to help out where needed in the COVID-19 fight. Hubert Pierre says at the moment he believes the Red Cross is doing all that it can as the fight against COVID-19 is everyone's business.
Days after Behavior and Communications Specialist Bennett Charles expressed his disappointment that the St. Lucia Red Cross did not have a presence during the rounding up and quarantine process of the returning St. Lucia nationals from Martinique last week, the organization's director said they have been making efforts where possible and are willing to step in where needed to aid in the fight against COVID-19. Hubert Pierre told Hot 7 News that the organization is as prepared as it can be on all fronts.
We have attended NEMAC meetings. We have, of course, the meeting to do with supplies management, because as far as we are concerned, it's not simply the health issue. There are many underlying issues, and in the next few months we will understand what it is. The virus may be gone, but the problem of food security might be how many persons have lost their jobs and all of that. So we have been meeting with core groups to underline these factors and see how we can do. And most of our scenarios have been built around it. I think we are trying our very best. We have written the 3 scenarios. One where, of course, the early system, then we have the mitigative measures we are taking now. And we're actually looking at rule 3, for full-scale escalation, which we hope doesn't take place. Our volunteers, we want to tell them that please follow all the rules, because very early in the game, we have persons who work in the south of the island. I ask them not to come to work, don't take a bus in the public and come into the office, etc., etc. So we, from the Red Cross point of view, we are doing all that we can to prevent the further spread of this.
Pierre spoke directly to the persons coming to the island, especially those doing so illegally. He asked them to do the right thing for the good of the masses.
We are very concerned with the fact that persons came in back door. And we are hoping by some design, persons in the community will either encourage them to go to to see a doctor or do something like that, or they themselves would at least come to the authorities and say A, B, C, D, just that we prevent this thing from escalating.
When asked whether he thinks the organization is doing enough, he said he believes they are.
Red Cross itself is trying to do all it can do to enable St. Lucians to fight this thing. And this is where I say, if it's for me personally, we can speak in a different forum. But on the Red Cross viewpoint, we are doing what we can within the given situation.
Pierre said the Red Cross will continue to operate under the National Pandemic Influenza Plan that was passed by Cabinet in 2009. St. Lucia, he said, has one of the best plans within the region, and that they learned a valuable lesson from the days of H1N1, swine flu and bird flu, to name a few. Reporting for Hot 7 News, I'm Rochelle Gonzalez.
Thank you, Rochelle. Now, Cuba is lending a tremendous amount of assistance to St. Lucia in the fight against COVID-19. Hot 7 TV spoke with the Cuban ambassador on Cuba's assistance to not just St. Lucia, but other countries as they battle the new coronavirus.
The world is experiencing one of the worst moments possible, so it is very important that there is solidarity between Cuba and St. Lucia. Cuba is here to help. This was the message of Cuban Ambassador Alejandro Marin as he underscored the importance of maintaining cooperation between governments during the COVID-19 pandemic. The Spanish-speaking country has dispatched scores of specialist nurses and doctors to several countries in the region and internationally, some severely impacted by COVID-19, to assist with treatment and containment. St. Lucia will be the next to welcome a dispatch of 100 specialist doctors and nurses from Cuba to assist in the establishment of a respiratory hospital.
The Cuban authorities very quickly, they started to work, and we can say right now that according to the St. Lucia request, I repeat, according to our sister St. Lucia request, there is all the conditions created right now in order to send to St. Lucia a group of Cuban specialties in different lines of medicine in order to assist St. Lucia to work together with the St. Lucian medical system in order to fight the coronavirus.
Ambassador Marin went further to say that the Cuban government also stands ready to offer additional assistance in the form of the antiviral Cuban drug interferon alpha 2B, which has been used in China to combat the infection.
The idea of the solidarity, the idea of cooperation with the people who are in need, particularly with the country that doesn't have the possibility to the material, the human resource possibility. We are talking from the same beginning about Africa, Latin America, the Caribbean. For example, the first medical cooperation of Cuba was in 1963 in Algeria. So just 3 years after the triumph of the Cuban Revolution. So it just can give an idea of how, from the same beginning, it has been a principle of the Cuban Revolution.
He is confident that this collaboration will go a long way in assisting local health authorities to maneuver current conditions. Marin predicts that this will be another successful venture between the two governments. For Hot 7 News, I am Jacka Wooding.
This is the Hot 7 TV Nightly News. Stay with us. There's more coming up after the break.